So I oftentimes help patients understand that something that has happened to them caused the start of this process, and emphasize the importance of healing that. And many people are open to spiritual healing. Some want to call it energetic healing. I don't try to proselytize anyone. It's just a matter of understanding that we are multidimensional beings of thought and energy and mass, and all of these things need to be engaged in the healing process.
Because this, of course, it's not considered scientific. Clinical trials are very expensive, and they're really only embarked upon if there's going to be some sort of financial return. And so we need to understand that the evidence for what we're talking about is N equals 1, and it's from observational studies, and that's very valid. And and one of the reasons it's valid is because it provides an evidence layer, but we're not actually talking about toxicological drugs here. We're not talking about experiences that if they go wrong, that's called iatrogenesis, you're going to be harmed. So this is just as valid. And so when I think about someone that is working a 40 to 50-hour week, and they've got poor nutrition, and they're exhausted, and they're not sleeping well, and they feel terrible when they wake up in the morning, these conditions are salient, and they're part of creating the body's, the terrain, that then makes you more vulnerable to some form of chronic illness. But a precursor can be inflammation. That would make sense.
Oh, absolutely. It's all interrelated. It's all interrelated. We know that, the stress and high cortisol and acopia and poor sleep, and we make our melatonin when we sleep, and melatonin is very important for immune function as well as autophagy of cells, and our also regeneration. And so these very critical pathways that are disrupted by our modern important lifestyle, where we're suppressing our pineal gland function right up until midnight when we turn our devices off, and instead of perhaps having face-to-face conversations with family, reading an actual book that doesn't involve an LED screen, and just some of these quick hacks, and getting rid of the alarm clock that's blinking in your bedroom, and all of those things are just very quick hacks for restoring sleep. And we know that when people exercise regularly, even 30 minutes 4 or 5 times a week, they almost all of them improve their longevity from any cancer.
We know that oncologists don't have much time to review the scientific literature. And I know, for example, that medical doctors in New Zealand have attempted to say, I want to prescribe nutrients, and they've been told, no, you're a medical doctor, you can't do that. So as a conservative profession, and I'm very open to oncologists emailing psgr.org.nz, this is and info@psgr.org.nz to actually tell me I'm incorrect. But I believe that, or I understand it's a very conservative profession. So if oncologists start saying, I think your vitamin D should be this level, your vitamin C, where is your magnesium, selenium, and we might talk about this in another interview, they risk being reported. If there's a patient that's conservative that doesn't really want to address that, they risk being reported. But the problem is they're in a rock and a hard place, because they're used to using the clinical evidence. Well, there's no clinical trials. And the other problem is that am I correct or incorrect, that the nutrition education is minor. You'll probably spend more time as a medical doctor studying toxicology than you will nutrition. So it's not a comfortable space for a very conservative profession to be in. Am I correct there?
Oh, you're absolutely correct. And the literature is very replete with studies on nutrition, but it's sort of a siloed mentality that, people that are selling vitamins or in the natural health world are going to be more knowledgeable about that. And I was very, very, I loved my education through ACNIM. It was just fantastic. I would love it if it was incorporated in all medical schools.
So
But
that's the
we know,
Australian College of Nutrition and
yeah,
Environmental Medicine.
correct. But that type of knowledge has been basically, it doesn't generate money for the big corporate players, and that's been a factor since the Flexner Report of 1910. And that was funded by the Rockefeller Foundation, the Carnegie Foundation, and these big players that, you know,
They
doctors
influence the
basically have to,
trajectory.
yeah, that started the trajectory of modern medicine being sort of the focus being drug therapies. A drug for every disease was the aspirational model.
And it was
And
difficult, in that environment. Would it be difficult for a medical doctor to use iodine?
oh, absolutely. I've been absolutely vilified by some of my colleagues, and that was one of the aspects of the sham review proceeding. The reviewer didn't like that I prescribed vitamin D and B12 to my patients, even though my patients were doing very well and they could demonstrate no harm. And all of my patients were the ones who, or most of them, had been sent home from the public sector and told there was nothing else that could be done for them, and they were living long and living well. And so you would have thought that that would have been an incentive to say, wow, how can we help people? But it became an incentive to vilify me. And so I realized I just had to find a different place to practice, or a
Yeah.
different
And
model.
and this becomes really, really crucial for people, because what you have been able to demonstrate, and with N equals 1, is patients that are living longer for a stage 4 cancer, say pancreatic, than they would be on medical treatment alone.
Correct. I have a couple of pancreatic cancer survivors who have been living 6 and 7 years with no surgery, who were diagnosed with stage 4 disease in 2016. And it's not me. It's using the first principles and understanding how the body works, how nutrition works, and putting it together. And the literature that many oncology colleagues would reach for is some of the literature that shows that the overutilization of supplements actually is correlated with a bad outcome. Because a few studies have been done that utilized high doses of beta carotene, for instance, and it turned out that patients who did that actually did much worse than people that didn't take supplements at all. We know that certain chemotherapy drugs are going to be abrogated by folic acid. We know that some cancers will actually be prevented by folic acid. But I think the real issue is knowing when to use what and in what setting. And patients cannot be expected to find their way in that space on their own, because each cancer is in many respects as different as the person who made it, and it requires an understanding of the person's diet, where they've been, their stressors, their strengths, and all of those things that actually they bring to the table as part of their healing. And what are they willing to do? What does their budget allow them? They can't afford organic food, but maybe we can help them choose some healthy vegetables and some simple supplements and a different way of thinking about what's bothering them.
So talk again for everyone about stopping that car.
Well, I think it comes down to the natural selection. When the process of natural selection involves, when we have a certain, you know, stimulus, resistance, whatever, if we are driving something towards a certain place and yet we're trying to stop it over here, we're not going to get very far. And so it's very, patients understand the when they're trying to stop their car, they want to take the foot off the gas pedal. And the gas pedal is driving that cell or the cancer phenotype to make more of itself, to go through clonal expansion in response to injury and inflammatory signals. We know that the immediate early genes, Jun and Phos, those are direct injury signals. Well, that's also going to be telling those stem cells, come over here. Let's start a new settlement. And so I think those are, you know, very important and easy things to work on. And there's a lot of information now about plant-based diets, and we could discuss that. But just in general, understanding that a lot of the intellectual patent rights that are are related to genetically engineered species that are appearing in our food without our knowledge, and the genetically engineered oils that have been approved for general consumption, these are all pro-inflammatory. We don't have the tolerance, the immune tolerance that has taken thousands of years for the human species to develop to eat lactose, for instance. You know, all of these things are related to what our ancestors were eating for generations. That's where we get the immune tolerance of the gut. And when we start putting proteins and gene sequences into our bodies that the body doesn't recognize as food, an inflammatory signal is generated. And this is why we're seeing, I think, such an epidemic of gut cancer, especially in young people.
Yes.
And certainly the other inflammatory things that have happened in the last 3 years have not been helpful.
From weaning, they might be fed wheat bix, you know, that's been sprayed with Roundup.
The Roundup, I think it's important for people to realize that its original patent was as an antibiotic. So the antibiotics we know actually reduce the biodiversity of the gut microbiome, which is critical to the immune tolerance and the control of the inflammatory response in the gut to the food that we eat.
Yeah.
And because so many of our processed foods contain various residues, from triple herbicide resistant soy to triple herbicide resistant canola, and the pre harvest desiccation with the Roundup.
The Australian Total Dietary Study in the 25th one, in the appendix, you'll see the degree to which cereals, biscuits, crackers, all the wheat-based products have not just glyphosate, but they have a combinatory effect of other pesticides and
Correct.
other ingredients. So this is part of the reason why perhaps, you know, eating less of this is good. Now, I do want to finish off by, so you talk about taking your foot off the gas pedal, because, you know, medicine is putting on the brake. But another thing that you talk about is the war on cancer. So we're finishing off with a discussion on the war of cancer. So if we're truly at war with something, as you've written, and victory is actually contemplated, would we feed and supply arms to our enemy?
No, I think clearly the answer is no to that. And this is why I think James Watson was skeptical when Richard Nixon declared war on cancer. Richard Nixon's war contemplated nothing to do with asbestos, vinyl chloride, benzene, all of these things that were known to be carcinogenic. And there was not much done with smoking until many years later. So the war on cancer was basically a declaration that a lot of money was going to be put through the National Cancer Institute for cancer research and drug development, but not one thing was going to be done to look at our environmental influences on cancer
This is in
development.
1971.
Yeah, the 1971, the war on cancer, and it's still an ongoing war, and we have more cancer than ever before. We have more people living with cancer than ever before, but we have not, by any stretch of the imagination, either cured cancer or stopped cancer. We've created more cancer because we have failed to to address the underlying causes, which I think must change in the next little while.